Hello everyone, it's Fatima Franklin, and I am taking this psychology class for my degree in nursing. And the question that we were asked is, what is psychology? So psychology is the scientific study of the mind and behavior. Um, the next question was, what do psychologists do? Um, so psychologists, they conduct studies of behavior of the brain and the function of the brain, and they observe and interview um, patients to identify psychological, emotional behavior, and they diagnose disorders as well. Um, the next question is, what is the origin of psychology? Let's see. Um, well, psychology wasn't a separate discipline until the late 1800s. Um, its early history can be traced back to um, time of the Greeks during the 17th century. Um, uh, a French philosopher named Rene Descartes introduced the idea of dualism, and this asserted that the mind and the body were two entities that interact to form the human experience. Um, and the last question is, how can psychology be applied to nursing? My opinion of how psychology can be applied to nursing is, I feel like as nurses we use a little bit of psychology on our patients every day. Okay, so you have a patient who is irate, doesn't want to take their medication. As nurses, we have to know how to use certain methods to get the patient to take their medications, such as um, changing the subject or speaking on something else, or offering the patient something, or just speaking nice to the patient. Um, all of these things. I think it's very helpful to know psychology when you're in nursing, because we have a lot of patients who you know um, are not stable mentally, and you just have to know how to talk to that patient so that you won't set them off and cause the issue to become worse. Thank you so much. This is Fatima. Bye.